Steps of a facelift surgery. The standard facelift surgery starts with the placement of incisions in the area just inside the hairline at the temple, extending down along the curve of the ear and behind it, then horizontally into the hairline. The surgeon will sculpt the face, tighten the muscles, restore fat to areas where it has lost volume, and pull the skin into a new position. In most cases, the superficial musculoaponeurotic system, SMAS, is also tightened by folding it and then pulling the layer back over itself. This helps to lift the cheeks and give more definition to the jawline. If the neck is also being treated, the surgeon will hide a small incision under the chin and manipulate vertical bands in the neck for a smoothing effect. Finally, the surgeon drapes the skin over the new sculpted foundation and closes the incision points with sutures or skin adhesives. Facelift patients generally go home from 2 to 24 hours after the procedure. Most patients are able to return to work and perform light activities in 1 to 2 weeks. Surgical facelift, the different techniques. Mini facelift technique. The mini facelift works well for young patients who are noticing the first signs of aging. Also known as a weekend facelift, mini facelifts are less invasive and require less downtime. It may not be able to completely target problem areas like the brow line or forehead, but with healing time as fast as 2 to 3 days, a lot of people in their 30s and 40s find that it is the ideal solution to the sagging that is beginning to show their age. A mini facelift won't leave your skin looking as if it has been pulled too tight and then fastened behind the ears. Instead, it simply offsets some of the effects of time and gravity, so your face looks a few years younger. Skin facelift or subcutaneous facelift. The skin facelift or subcutaneous facelift is used mostly for thin patients with some excess skin but with good position of the facial muscles. It is also used for patients who already had a deep facelift but need a touch-up. The subcutaneous facelift is basically a two-fold extension of the mini facelift, in which the incision made around the ear is extended to reach above and behind it. Also, the undermining of the skin is more extensive, sometimes reaching over the neck and face. When cutting under the skin, the surgeon releases the fascia and muscles, so the skin can be pulled to a better position. The skin is also moved slightly upward and laterally to regain its natural position during youth. The surgeon makes sure that there is little tension in front of the ear. In fact, all the skin tension is applied above and behind the ear to prevent an operated look. SMAS, Superficial Musculoaponeurotic System, Facelift Technique. Superficial Musculoaponeurotic System, or SMAS facelift, is used to treat sagging cheeks or jowls by removing excess skin and manipulating the SMAS layer. The SMAS is a sheet of muscle and connective tissue joined together in the cheek. Over time, there is a gradual loss of elasticity in the superficial layer of the skin, and the SMAS tends to sag and become lax, causing jowls and deepening of the nasolabial folds. A SMAS facelift is performed by making an incision pattern similar to that of the traditional facelift. The next step involves lifting the skin, cutting the excess and tightening the SMAS tissues. The surgeon then sutures the areas back in place. When done correctly, the facial skin looks tight but not pulled. Also, the result is more extensive and lasts longer than a skin-only facelift. Deep plane facelift technique. The deep plane facelift technique was designed to address the limitations of previous facelift techniques. The results are achieved by incising deeper to adjust thicker planes of the face. The surgeon is also able to release the suspensory ligaments below the mid-face to readjust mid-facial drop and to soften the nasolabial folds. It dramatically corrects the signs of aging in the mid-face and upper cheeks, since the surgeon can reposition the tissues in those areas. Thread lift technique. The thread lift is a non-surgical technique that can be performed in as little as 1 hour. During the procedure, sutures with a long needle are threaded into the deeper soft tissue structures of the skin. Once the suture is in place, the teeth on one end grab and lift the sagging skin, while those on the other end anchor the skin to the rest of the facial tissues. The ends of the sutures are cut, leaving the suture buried under the skin. No incisions are made, no skin is removed, and no scars are left behind. This technique is mainly used to lift the brows, cheeks, jowls, and neck. It is fast becoming the facelift of choice among younger people who want subtle, preventative procedures that deliver natural results in the shortest possible time. Click Next to find out more about non-surgical facelift.